breast cancer. It's the second leading cause of cancer death for women in the United States. And this Breast Cancer Awareness Month, we're learning of a fast new technology. It helps track cancerous cells with more accuracy. And also, let's make, you know about this personally, right?
I do, yeah. I do. We're going to talk now with breast surgical oncologist, Dr. Courtney Fulton. Good morning to you. Thanks for being here.
Thank you so much for having me.
So we can't be reminded too often about doing your own self-breast exams, about looking for symptoms and signs. So right off the gate, let's just talk about what should we be thinking about? What should we be concerned about?
Well, most people that find a breast cancer themselves, it starts out as a lump, but there's actually a lot of other symptoms that can happen. So changes in the skin, puckering, dimpling, changes in the nipple, swelling, pain. So I usually encourage patients that have any new change in their breasts to seek medical attention.
So how important are things like screenings for mammograms? How often should women or even men be getting them?
Well, women are encouraged to start their mammograms at age 40, and we encourage them to do it every single year. There are actually no guidelines for screening in men. That's an individual decision, usually based on something like a genetic risk factor or strong family history.
Okay, let's talk about the Molli technology. So I actually, doctor, I had a little bit of a cancer scare last year. So I had a mammo that looked suspicious, so they had me go back in, and then they did a biopsy, and they found some tissue that they were concerned about. So I ended up needing to have that taken out. But they did the Molli, and I'd never heard of it. So I went in and I got the little marker, whatever it is. Like, you can explain it, but it was fascinating to me how they are able to direct the doctor to the exact place to make sure they get exactly what they're looking for, and it makes all the difference.
Yes, absolutely. So the old way that we used to do this for cancers that we couldn't feel or abnormal tissue that we can't feel with our hands is to use a little guide wire that came in through the skin, and it actually kind of hooked around the tissue of concern. The problem with that is you have to take it out the same day because people have this wire sticking out of them, and it can be very painful and uncomfortable and difficult for the surgeons to find what they're looking for. Whereas the Molli seed is so small and it can be placed right next to the area of interest, and we use a little wand to track it, and it tells us exactly how far we are away from it. So it's much more accurate and much more comfortable for patients.
It's like a GPS, so, right?
Well, absolutely.
Yeah. So can both of you help me out here? Just educate me. Is the Molli, does that come after the mammogram, or does it replace
it? So when they find the suspicious tissue, they put that in there. Once, you know, they do it with the mammogram, and they say, okay, this is where it is. I'm going to put this there. And then the surgeon can go back in and know exactly what tissue they need to take out, because the beacon, the marker is kind of going off, right? Is that right?
Absolutely. So it doesn't replace mammograms. We still need mammograms to find the abnormal areas. But what it does replace is the older technology that we were using as surgeons to locate these tiny lesions and then remove them. So it's placed right before surgery.
You know what I think is so important about this? It's just the hope that there's all these new technologies that are happening, because for so many people, I think you feel like, gosh, 1 in 8 women are going to get breast cancer, and it feels so, terrifying. But yet, there's all this hope with all this technology that is making things brighter, and there's a future there.
Absolutely. So I'm super excited to stay on the cutting edge of surgical technology, but in terms of overall breast cancer treatment, we have so many more options than even 5 years ago. So it should be very encouraging to patients that, we can absolutely treat women at every stage of the disease.
So doctor, let's say someone's watching at home right now, and they're, like what Lynette just said, they're scared. Is there anything to be scared about, or is this a procedure? I'm talking about the mammogram.
Mm-hmm.
Is there something you can say that could make people feel a little bit better? Like, oh, it's only going to hurt for a little bit, but the reward at the end, that's what it's all about, right?
I think there is a lot of anxiety around mammograms. I think a lot of people have built them up in their head as this horrible, painful thing, but really you're in and out so quickly. And nowadays our technologists are trained to keep patients' comfort in mind. And, I've had a mammogram myself, and it's not as bad as people think it is.
100% agree with you. And I always do my mammogram in October, and I am due, so I'm going to make that appointment Maybe right now.
Great.
I'm going to go online right now. So thank you so much for sharing that with us. We really appreciate your time, Doctor. For more information on Molli, you can visit Molli. That's Molli. That's how it's spelled, so you know. MolliSurgical.com. Thanks again, Doctor. Have a great day. We'll be right back.